Hey there, let's talk about Medicare Advantage plans and filling in the gaps with a hospital indemnity plan, also known as an HI plan. What do I mean by gaps? Well, let's go back to the Medicare Advantage plan, also known as a Part C. There's gaps in it, meaning we have a max out of pocket. The most that I'll pay for my health care with copays for the year, once I reach that number, which is about 3,200, 3,500, once I reach that number, I won't pay another copay for the rest of the year. January 1st, it resets. That does not include your Part D prescription drug copays. You also have other out of pocket gaps. You're going to have copays. You're going to have coinsurance, and the coinsurance in a Medicare Advantage plan is going to be your durable medical equipment, or DME, like wheelchairs, walkers, commodes, or your Part B as in boy drugs. That is completely different than your Part D as in dog drugs, right? Part D as in dog means I'm going to the pharmacy at the drugstore. Part B means that I'm going to the doctors or the hospital to have a prescription or drug administered, like chemo or insulin pumps and things like that. Okay, now that we got that done, let's go back to why I would want the HI plan. The HI plan is an insurance product, like I said, and it's just like getting car insurance or homeowners insurance. And then if I'm in the hospital for, 5 days, and my copay for the hospital is $150. When I get home, I am going to start getting bills for that if I haven't already gotten a bill before I left the hospital. Now, I am going to take that bill and I'm going to submit it to the Hospital Indemnity insurance company. Okay? I'm going to do it. It has nothing to do with the hospital. We're not even going to tell the hospital we have this product. All right, but I'm going to come home, I'm going to get the bill in the mail, and then I'm going to submit it to the Hospital Indemnity company, the HI company. They are going to look at it and they're going to say, yep, she has that coverage. So then they're going to write me a check for $150 times 5, or how many days that I have my policy set for, my limit set for, and how many days I was in the hospital. They're going to write me a check and send it to me to pay me back that insurance copay that I had to pay on my Medicare Advantage plan. Now, we don't want to mess this up and give this to the hospital to do, because if they overpay or they pay us more, if I set my limit on my policy at $200 a day for my hospital stay, and my copay is only $150, well, I've just made $50. Do you see what I'm saying? And I don't want to credit at the hospital. So we're just going to do this all ourselves. I'm going to submit it, or if you've done this through an agent, you can call your agent and have your agent do it for you. All right, I do it all the time. I submit them for my clients all the time. They get a check in the mail. They cash it. They either, reimburse themselves for the bills that they've already paid, or they use the money to go ahead and pay. You can also, with a hospital indemnity, you can also, in most cases, tack on a cancer rider. So, God forbid you are diagnosed with cancer, whatever your amount that you have selected, whether it's 10,000, 20,000, 30,000, as long as you have been diagnosed by a doctor and you have the proof to send into the insurance company, they will cut you a check for that. There's also a heart and stroke rider that you can add on to these insurance policies. These are good policies to have if you are on a Medicare Advantage plan. And in all honesty, they're good plans to have on just about any health insurance, whether it's with your employer or you're on the Affordable Care Act, also known as ACA, because it helps reimburse your copays. All right. And it kind of takes away that scary, oh my gosh, I have, $300 in copays, but if it's something reimbursable by your hospital indemnity plan, you can submit it to them and they will go ahead and write you a check and send it to you in the mail. You go to the mailbox, you take it out, you bring it to the bank or however you deposit checks, and then you're reimbursed. If you guys have any questions about hospital indemnity plans, go ahead and put them in the comment. One thing I do want to say, you do have to go through underwriting with these products because it's not health insurance, it's a insurance product. So when you are getting onto a Medicare Advantage plan, if you are young, 65 years old, I suggest you get on one now, because The co-pays for Medicare Advantage plans are very low. They're $0 to most of them are $0. So you're not really spending any money on your insurance product that you have for your health insurance. So most hospital indemnity plans run between $35 to, I've seen them as much as $79. I've seen them higher, but that's because they've added other stuff onto them. But a basic HI plan is going to be anywhere between $35 to $80. All right, so it's a good thing to have, because it's just reassuring to be able to say, okay, well, I'm going to have to spend this money at the hospital. I don't really want to, but I have to, and now I'm going to just submit it to the hospital indemnity insurance company, and they're going to help me with that. All right, if you guys have any questions about HI plans, put them in the comments. Any questions about Medicare specifically, any parts of Medicare, Medicare Advantage plans, original Medicare, Medicare supplements, put them in the comments and I'll be sure to answer them for you. Have a great day.